Welcome to another session of Montgomery Heart and Wellness. We are coming to you late here in Houston, and um, what came across my news feed was the autopsy report of Ray Liotta. Many of you may have known him. He was a well-known actor. He actually passed away a year ago, um, and he died in his sleep. So the autopsy report was just revealed um, a few weeks ago, despite the fact his death was May 26th. And the interesting findings of the autopsy report were that he died of what's called coronary artery disease or cardiovascular disease. There was atherosclerotic plaque in the arteries in his heart. And also, interestingly enough, there was fluid in the lungs. We call it pulmonary edema, and I'm going to explain some of this to you in a few minutes. But fluid in the lungs, pulmonary edema, and fatty plaque built up in the arteries. So essentially, he died of heart disease. Now, they did not say that it was a heart attack necessarily, but rather atherosclerotic plaque in the arteries of the heart. So I found that to be fairly interesting because most of the time when people die in their sleep, it's usually due to a heart attack, which can cause an acute sudden onset of heart dysfunction, or it could be an arrhythmia, which is an electrical storm where the heart starts to fibrillate and circulation is suppressed in a short period of time, and you die. You die essentially. You cease to get blood flow to the brain and other vital organs. But let's go over this. I think there's some very interesting information here. It's an unfortunate loss for the family. And again, I always, as always, like to send my condolences to the family members in situations like this. They don't know who I am, but I think it's the right thing to do. And our prayers go out to the family. It's been a year, but I'm sure there's still considerable grief. However, what can we learn from the unfortunate death of Ray Liotta? Well, let's look at the cause of death. And what I want to do is review some of the key findings of the autopsy report because heart disease is the number one cause of death in the United States. Our lifestyle predisposes all of us to heart disease, and actually, it's the number one cause of death worldwide. We're transporting, exporting, I should say, our poor lifestyle. So, what is the meaning of the autopsy report? So, here you have one part of the report. And again, this is the news report that came out, but the one of the findings was cardiovascular disease. I have that highlighted in red. They also denoted that he had atherosclerotic disease. They also state that there was findings of what's called pulmonary edema, and they state that the cause of death was respiratory failure. So, what do these medical terms mean? I think it's important for us to understand what they mean. He died in his sleep, but I think there was some significance of his death in his sleep. And what I want to do is share with you the meaning of these things, and also share with you how these type of findings could be underlying findings in anyone who's alive, and they can be manifested in certain symptoms. So if you have certain symptoms, you may have these conditions, and you can do some things about it to prevent sudden death. So cardiovascular disease, this is a busy slide, but simply cardiovascular disease, cardio meaning heart, vascular, blood vessels, it's really a breakdown of the heart and the blood system. Uh, it's a progressive breakdown in this system. You also have atherosclerotic disease, which is a buildup of fatty substances known as plaque. So if someone tells you that they were diagnosed with coronary artery plaque, or you're diagnosed with plaque, the plaque that builds up, it's not like the plaque on your teeth, but plaque in the arteries is fatty substances. And so they can obstruct blood flow in the arteries. So if this is blood flow in the heart, that can be problematic. Pulmonary edema. Pulmonary means lung, edema is swelling. So essentially, this is literally means swelling of the lungs. But in essence, it's progressive collection of fluid in the air sacs of the lung. So in the air sacs of the lung, that's where you have gas exchange. When you breathe in, you bring in oxygen, and you breathe out CO2. And in these air sacs are lined really close to blood vessels. And so the blood vessels, called capillaries, exchange gas. So the carbon dioxide that builds up in the blood vessels gets into the air sac, where the carbon dioxide is breathed out or exhaled, and the oxygen that's breathed into the air sac, it crosses the membrane and goes into the blood. So that's how you oxygenate the blood that then goes to your body. So it's a very important. These air sacs are very important. So if these air sacs, if the lining around the air sacs start to swell or fluid build up in the air sacs itself, then you have the inability to exchange gas. Also, when the lungs start to swell, the lung gets boggy and heavy, and it becomes difficult to move the lung. So you start to develop respiratory failure. So a swollen lung is a heavy lung and a stiff lung. And so when you try to breathe in and out, your diaphragm has to pull down. And you also have muscles in the chest wall that also expands to contract and open up the lungs and contract to push things out. But when that lung gets heavy, it gets stiff and boggy, and that respiratory effort becomes great, and it can lead to respiratory failure, which is a progressive or sudden inability to breathe. So your ability to breathe, inhale, exhale, is how you ventilate your body. You ventilate your blood system in the same way that your air conditioning system help ventilate your home. You ventilate your circulatory system by breathing. And so a failure to breathe, or respiratory failure, is a failure to ventilate your blood system and bloodstream. So that's a pretty significant problem. And these are the findings that were denoted on the autopsy. So I have here a little diagram, a little movie diagram, to show you what progressive atherosclerosis is. And if a picture's worth 1,000 words, then a video is worth 1,000,000. Before we get to this, I want you to hit the thumbs up, give us a like symbol. Also, if you hadn't had a chance to subscribe, please do so, and hit the notification button. And of course, by all means, share this video. It's important that more people get this basic information about what heart disease is and some of the simple things that you can do to prevent it. So let's take a look at this video here. And this is going to show you the progression of atherosclerosis. So here you have the beginning, a normal artery, healthy arteries see the blood flow, the red cells, the white balls of the plaque, inflammatory cells. Now you see plaque building up here, the early sign. And this happens over years and decades. More plaque on both sides of the artery and slowing of the flow. And then you get more progressive plaque to where you get almost blood flow nearly a standstill. And so over time, from 1 through 4, you can have progressive symptoms. These symptoms start from, of course, no symptoms at 1, mild or no symptoms at 2. In fact, there are many people get to the stage 3 and they don't have symptoms. It's not until stage 4 they start to have symptoms. Or you may have symptoms at stage 3 that you simply ignore. So you can have pretty advanced heart disease despite the fact that you may not have a severe symptom. So you have to be aware of your risk factors. And if you have any tests done by a physician, like an abnormal EKG or abnormal findings in the blood test that can indicate that you're predisposed to plaque, then you probably should get some more advanced testing, or probably exercise some of the lifestyle changes that we're going to talk about pretty soon. Now, a few questions are popping up in the chat, and someone asked if fasting can get rid of plaque. The short answer is yes, and I'll get to some of that in a little bit. Here's another video animation, a little bit more of a realistic video. And this is, you're looking at the vessel head on, so the blood is coming towards you. And you see here a rim of plaque there. And you're going to see, so this plaque can start early on. We know from autopsy studies, young kids, 14 to 16 years old, can have plaque like this. We know from autopsy studies in military men in their 20s have plaque like this. So we know that plaque like this can start very early on in life. So let's see how it can progress from this seemingly possibly early stage. So you see the blood vessels coming through here. They're moving reasonably well, Now you see the plaque progressing. And this can happen over months, or it can happen over years or decades. But you notice the vessel, the flow becomes more and more encroached, and you have progressive obstruction of flow. I'll play that again for you just to give you a picture. So improved flow here, the blood vessels are coming through, and the plaque is building up, and this is progressive plaque. So this process was going on in the body of Ray Liotta. And so one night he, succumbed to an acute episode. Now what you can't rule out is that it's possible that he could have had an arrhythmia. So even though he had coronary disease and plaque buildup, he also could have had an arrhythmia, because typically when someone develops progressive atherosclerosis like this, and it's very severe, and their lungs start to fill up, they start to have symptoms of acute shortness of breath and or cough that wakes them up. And so the fact that he didn't have cough or acute shortness of breath that didn't wake him up makes it a little bit suspicious in terms of, hey, was this really pulmonary edema, or could he have had a cardiac arrest? So, that's the one thing that, I question in this situation. However, be that as it may, the important thing I want to share with you is, what can you do? What can you do to address this problem? First and foremost, we need to determine what situation. If this is an acute situation, severe symptoms, so it's like sudden onset, sudden worsening of symptoms, so sudden worsening of chest discomfort, sudden worsening of shortness of breath, a sudden sensation of anxiety, or you have these symptoms of shortness of breath, chest discomfort, coughing that wakes you from sleep, suddenly wakes you from sleep. Well, it's important to know that, hey, this may be an acute episode, so something that comes on all of a sudden, acute onset, that wakes you up, or severe sweating, or severe nausea, vomiting, or severe pounding in the chest. So this can be an acute episode. What you should do is call 911. Okay, get professional help immediately. Call 911 first and foremost. Next thing you should do, get someone near you. So if you're in the house by yourself, call a neighbor, call a friend, call a loved one. If there's someone in the house, wake them up. If it's in the middle of the night, make them aware that you're having symptoms. Have them by your side. If there's some delay in the ambulance or medical help, maybe they can drive you to the emergency room. You'll have to make that judgment call. Take deep breaths, pray, meditate, calm yourself down. Frequently, you're anxious. Doing things to calm yourself down can help you. These are some basic, immediate steps you can take while you're waiting on professional help. What if you have mild or stable condition? Maybe you already know you have heart disease. You have a high risk for heart disease, and you have symptoms of chest tightness and fullness or heaviness, or you have shortness of breath or fatigue. If you have these symptoms, maybe they've been going on for a long time, you can take action now. One, you should seek medical attention, make a doctor's appointment if you haven't had a doctor's appointment, to evaluate how severe your condition is. While you're waiting to get medical attention, you can do some things on your own. Clean up your diet, start a nutritional cleanse, 100% plant-based diet with intermittent fasting. We talked about how to do that in other videos. I'll have some information that's in the description here. Improve your sleep habits, improve your hydration, begin mild exercising if you haven't started. So these are some things that you can do immediately that can really help turn heart disease around. We've had individuals that we start on a nutritional plan and other types of natural approaches. And what happens is that the amount of inflammation in these blood vessels that predispose them for rupture and causing a heart attack, that inflammation is suppressed within days to weeks. So probably by the time you've gotten your doctor's appointment, you started your nutritional cleanse, your detox, you can start to heal your arteries in very short order. I see this a lot, and we've documented this in our medical center. So there are a lot of things that you can do to improve your health, even in the setting of advanced disease, even in the setting where you have symptoms and you know you have advanced disease. And if it's not an acute episode where it's a life-threatening situation, there are things you can do in the short run. And even if you are in an acute situation, you're sent to the emergency room and you're diagnosed with a heart attack, you're admitted, even while you're in the hospital, you can start these lifestyle changes, especially with your diet. So there's a lot you can do, even in the setting of advanced disease. So don't feel, worried or hopeless or helpless. There's a lot you can do. For more information, you can go to our website. These are the links we have on our website. We discuss the details of heart disease, different aspects of it. Is written for the lay public. However, professionals, medical professionals, I think can get a lot out of it. And then we talk about how you can detox. What does it mean to detox? What's the definition of the detox? That term is thrown around a lot, but we actually talk about what does it mean to detox. We give you insight in terms of how we've detoxed thousands of patients over 2 decades with great results. And we also have a video that can get you started on the detox. It's called a Jumpstart, and it's free. You can go on and ask lectures of me showing you with recipes and meal plans and things. And it's a 10-day Jumpstart, but you can repeat that thing multiple times, do a 30-day and 45-day Jumpstart using that. And many people have used that with excellent results. So what you should do is know that there's a lot that you can do. And our goal is to place you in control. It's not to create fear. And there are many individuals who succumb to heart disease, but you don't have to be one of them. So, anyway, I hope this has been helpful and insightful. If you've enjoyed this information or gotten a lot out of it, please, again, give us a thumbs up. Please subscribe, share, and help this video spread out to the world. I think it'll be very helpful to individuals to know these very simple, basic things that you can do to improve your health. Until next time, take care.